Dr. Harika Surapaneni, Director, Dr. Harika ENT Care Hospitals, Hyderabad. Today we are going to discuss about a topic called as anosmia. Anosmia is nothing but loss of smell. So why this anosmia happens? So many a times this anosmia, loss of smell, can happen for a short period of time, or sometimes it can be there for a longer period of times. So what are the main reasons for this? So for the short period of time, the reasons can be like allergic rhinitis. If a person is getting affected with allergy, if they have a tendency of allergy, so these allergic rhinitis patients will be having a symptom like loss of smell also. So whenever they have these allergic tendencies, whenever they get exposed to these allergens will cause inflammation in the nasal mucosa, because of which the air passage into the nose will be decreased, because of which all these smell sensation will also come down. So loss of smell can be seen in conditions like allergic rhinitis or sometimes even common cold. So these can be treated with medicines, and when these allergen exposure has come down, all these symptoms also will come down. So next, coming to nasal polyps. So even in conditions like polyps in the nose, because of the obstruction of the nasal cavity, the sense of smell will be reduced. So these physical obstructions like nasal polyps or any septal deviations in the nose. So septal deviation is nothing but the septum, the bone which is there in the center of the nose, gets deviated to one of the sides, and because of which there will be again nasal obstruction and loss of smell. Sometimes a strong chemical exposure can damage the nerve endings which are present in the nose, and because of which there can be a permanent damage for the sense of smell. So for example, if a person gets exposed to a very strong acid or anything like that for even a short period of time, so these strong chemicals will damage the nerve endings and can reduce the sense of smell. Okay, these days when after this COVID era, in this post-COVID times, we have been seeing a lot of patients who are complaining of loss of smell, and this is the reason behind this is because of the virus affecting the nerves, the virus affecting these nerves and damaging them. So when these nerves get damaged, the nerves which help in sense of smell, these nerves get damaged, and that's how the sense of smell comes down. Okay, many a times any neurological conditions, or if a person has an accident, or if he has undergone any surgeries in the brain surgeries or neurological surgeries, or if he had any head injury met with an accident, all these causes also can cause decreased sense of smell. Okay, also there's a condition called atrophic rhinitis, in which there is atrophy of the nasal mucosa. The mucosa within the nose gets atrophied, that is, it gets damaged, and because of which again the nerve endings also will get damaged, and there will be loss of smell in these conditions. So all these conditions should be addressed as early as possible and should be treated on time.